These longer needles work great, especially there's so much depth in the hips. So I'm gonna get a couple here. We're looking for some of those twitches, a little bit of feedback from maybe some of those trigger points deep in the tissue. We're just trying to get the muscle to fire, to flush out any kind of waste products, improve the circulation in the tissue. And it will help kind of improve his output a little bit because we're getting less feedback. Hi, my name's Dimotsantos. I'm an outpatient physical therapist, own a clinic here inside Kilo Club Gym. I work primarily with outpatient orthopedic, sports, post-surgical issues, and I work one-on-one with my clients in order to achieve the best and most complete resolution in the shortest times possible. Today you're going to see a quick video with me working on a patient in terms of what we do, the manual therapy, some of the corrective exercise, and so forth.
So you remember that little nagging pain I had behind my shoulder blade?
Yep.
Someone's pushing his finger
against like a boring face that way for me. Let's see. Which side again? Left, yeah, right? Okay.
I can't be waiting to be injured to come in here.
Yeah, because then you're playing catch up. So now I'm kind of getting in right where the rib and the thoracic spine interact, costovertebral joint. Just kind of assessing joint play, seeing if it provokes the symptoms. So we're just looking for replication of the symptoms. And then what I'm going to do next, we're going to do a little bit of like respiratory mechanics stuff, get you to expand and contract the ribs while I kind of brace and work against it. Take a deep breath in for me. Yep, and back out. We're just getting these joint segments to move. I'm doing it repetitiously just to restore some of the movement at the joint segments. What I want you to do now, let's add just a light load here. Go ahead and extend up. So you're gonna just do strict, shoulder extension. Good, 1. So now we're getting a little more than just having him lay there statically. We want to make sure that he's able to engage and move through all these ranges comprehensively. There not being any restrictions with his movement in all these different planes. Now we're going to do long lever, so palm down, and you're just going to come up and down for me right there. Yep. 1. Good. Just moving those vertebrae where they need to go. Okay, good. Now what we're going to do is a W lift off. So you're just going to come straight up here and down. Yep. So almost like a no pressing, just a 90-90 lift off. Yep. Good. 1. 2. Thumb up. Yep. We're going to get a little more engagement down here on the lower trap. Okay. 1. Just go exactly no more than you're able to get to. This is a 80-pound solid kind of cast iron roll. It will always kind of expose any stiffness in the thoracic spine. People go generally through the roof with this, but it's just a nice kind of generalized treatment. Doing this to just generally loosen up his thoracic spine a little bit more. Again, this is a stiff area in general, so it can take a lot of pressure. You know, we've got a lot of layers of muscle in the lower lumbar spine, especially somebody as well trained as Fred. You can just feel he's got very deep recess here in his spine because of how much tissue he's got, how many layers, hypertrophy the layers are. That's the beauty of this, is it's this heavy to allow us to really sink in and mobilize the tissue a little more aggressively. And then even sometimes, like say, now I'm kind of pinning and the back from here, I'll go right into the tailbone, kind of moving the pelvis via the sacrum and the coccyx. So you feel a little bit of kind of a stretch down there as we, Yep.
Notice though, my glutes were really sore on the sides.
You're getting a lot of tenderness out laterally, right?
Yeah.
So what we're gonna do, I'm gonna just expose it a little bit, but we're gonna get in kind of lateral to the hip and get in through glute med, try to get through glute max and into his glute minimus here.
That sounds fun.
We're gonna take the needle, we're gonna drop a little bit here into the hip. These longer needles work great, especially there's so much depth in the hips. So I'm gonna get a couple here. We're looking for some of those twitches, a little bit of feedback from maybe some of those trigger points deep in the tissue. You feeling that pretty good, Fred?
Oh,
Yeah.
About that.
but I'm going to show you a little bit of intramuscular stimulation. So what we do is we actually connect the electrical stimulation to the needles, and then it conducts it right through the metal into the tissue. So vastly more effective than putting pads on the surface and having to work through the skin's resistance barrier.
I would say it's more annoying than it is painful.
Yeah, just like
bad,
once the stim kicks in, you're not going to feel it as much. So you're going to start to see the muscle fire as I turn up the current a little bit here. So we're getting a little bit of fire in here. That referring down the leg still, Fred?
No, it's localized right now.
Okay.
It's just on a.
This is firing at an output that it's a non-fatiguing stimulus. So what that means is we're just trying to get the muscle to fire to flush out any kind of waste products, improve the circulation in the tissue. And it will help kind of improve his output a little bit because we're getting less feedback from, again, the pain fiber side and more from the motor neuron side. So what I'm doing is I'm pistoning the needle back and forth. So we're kind of using this to go back and forth into some of those hyperactive areas of tissue, again, to just disable the intensity of those trigger points. So needles out. Still feel a little bit through there.
Not much right now.
Not much.
I mean, you're punching it and hard feeling it.
Yeah, exactly.
Well, when I walk in here, you would just poke in that spot and it would hurt quite a bit.
Yeah,
And
so
right now, you're punching it. I'm not
Much
feeling
better.
that, so.
Okay, good. Awesome.
Yeah. Well, I mean, that's what I learned with you is that if I take care of myself, I don't have to see you as often.
And
So anything I shouldn't be doing or like
no,
No,
train,
good.
move. Yeah,
I'll be
mobilize the hell out of it.